It's counterintuitive, okay? So apex is the pointed part, base is the rounded top part. All right, then we talked about all those other things being in the, oh, that's nice, being on the paper. No, you know what, you can, I'm not going to waste my time here doing this, but you can unscrew these hearts and take them apart so that you can see inside of them. I'll just use the smaller one, okay? I won't waste any time here doing that. All right, so myocardium is muscle, all right? So this is muscle, okay? This is muscle, and this is muscle. The thick part of it you see is the muscle, myocardium. We'll talk about the differences later, but you can see the left side of the heart. Remember, you're looking at somebody else's heart. It's their left side, okay? That's going to be one of the major things you got to get, make sure you understand when we actually do this. So make sure you're holding the heart and saying to yourself, that's somebody else's body, that's their left side, okay? And so that you get the different chambers. But the left ventricle is thicker with muscle. We'll talk about why later on. This is the cross wall, all right? That's called the septum. And if you're down here between the two ventricles, then they call it the interventricular septum, okay? They get very fancy. And then if you go up towards the top, and you really can't point this out except for on paper, interatrial septum, okay? So let's see. Endo means to enter the inside. So that's endocardium. That's myocardium, okay? And then you have the left ventricle, right atrium, upper chamber, left atrium, okay, upper chamber there, all right? On the outside, if we put the cover on, this is referred to as an auricle. The word auricle, A-U-R-I-C-L-E-S, means ear, okay, or auditory kind of thing. Somebody said, hey, that looks like a big dog ear, okay? But that's the right auricle. It's sort of the outward stretchy part of the right atrium. Some people use auricle and atrium interchangeably. Really, that's not technically correct. And then that would be the left auricle. We'll talk in lecture about what you find in there, because I don't think it shows up on your sheet, so I'm not going to even talk about it now. Okay, interatrial septum. Well, we go back and we separate. Oh, I keep doing this to myself. I can't really see the cross wall between the right atrium and the left atrium. So interatrial septum, you can put down next to that on paper only, if I even bother. Okay, probably won't bother because there's so much to ask anyhow. Septum would be good. All right, enough. All right, coronary sulcus, to sulk. When somebody sulks, they go, Okay, the word sulcus, you learned it in brain, right? It's indentation. Gyrus is a bump, sulcus is a groove, all right? So the coronary sulcus is the indentation between the atria, the auricles, and the ventricles. And what we find lodged in the indentation are blood vessels, okay? We'll go, I think they're listed here, so we'll probably go through this. But that's on both sides. So it's an indentation between the auricle and the ventricle, outer view, all right? Outer view only. Your book has wonderful pictures. You'll see all of this. All right, we already did right and left ventricle. We already did interventricular septum, okay? All right, anterior, front of the heart, interventricular, inter means between the ventricles, ventricular, sulcus, a dent. All right, going right down the middle of the heart is a dent, and inside that dent are blood vessels, okay? So right here, this dent is the interventricular sulcus. In the back, I turn the heart around, posterior interventricular sulcus, the dent, okay, where the blood vessel sits, all right? Superior vena cava means on top. The word vena means vein, okay? Now, I won't say to always go by the coloration because there's one exception to the different colors, but this is the superior vena cava, okay? And this is the inferior vena cava. They left a little blue ring around it, but this is deoxygenated blood that's coming back from the lower part of the body. This is deoxygenated blood coming from the upper part of the body, above the heart, head, shoulders, etc. Both are dumping blood into the right atrium. Okay? All right, coronary sinus is actually, and none of these models show it well. None of them really show it well. Or at all, actually. We used to have a real small one, but I'll look around. The coronary sinus is a little bulge right here. It's not really pictured well on any of the plastic models, so maybe on paper, or maybe I can find that plastic model, but look in your book. It's a little bulge here, and it's an area of the blood vessel that has no muscle, so it doesn't contract and relax. It's just like a balloon type area because blood gets collected, all right, from the veins of coronary circulation. We'll talk about that later on. So it's just a little bulge in the back, coronary sinus, okay? All right, right pulmonary vein, left pulmonary vein. The first thing we need to know is that pulmonary means of the lungs, so it has to do with the lungs. Arteries take blood away from the heart. Veins take blood back to the heart, okay? So when we do direction, and you do have a question on that, you'll know that. Right pulmonary vein means that it's coming from the lungs back to the heart, all right? Which means it's going to be bright red. Visiting the lungs means you're getting oxygen, okay? So if it's going back to the heart from the lungs, it just got the oxygen, so it's bright red. I'm going to turn the heart around, posterior, okay? Here you can see these are the left pulmonary veins, these two red circles here. These are the right pulmonary veins, okay? So they come back from the lungs, and they both dump blood back into the left atrium, all right? So it's bright red. So pulmonary veins. If we turn this around, it's the same thing, okay? You can see the right and the left, all right? The right and the left, the red, pulmonary, okay? Now, if you're given a piece of paper that has no color in it, you have to know what chamber it's connected to, and that's more about following blood through the heart. So we'll get into that eventually, but not necessarily today, okay? And so you've got a couple of more models here. All right, pulmonary trunk, right and left pulmonary artery.